If you have been invited for a residency interview, then congratulations. That's a huge honor, but now you have to prepare. I'm Dr. Rajani Katta. I'm the author of The Successful Match and the creator of the Residency Interview 101 course. And in this video, I want to talk about a really underutilized question. So one of the most common questions, and I'd have to say it's asked in almost every residency interview, is what questions do you have for me? Now, there are a lot of standard generic questions that you can ask, and that's fine, but that represents a missed opportunity. And if you just work a little bit on the type of questions that you ask to your interviewer, you can really stand out and be memorable. So in this video, I'm going to present a few before and afters, and we'll talk a little bit about my method for creating these memorable and important to you residency interview questions. I wanted to do a few before and after questions so you can see how easy it is to elevate the types of questions that you ask. Now, when I was on the residency selection committee at Baylor, I would hear the same questions over and over again. And at the end of a residency interview day where you've interviewed 15 applicants in a row, the questions got a little bit old, even though they were fine. You know, there was nothing wrong with them. But I would be asked very frequently questions such as, what are the strengths of the program? What challenges do you anticipate the program experiencing over the next few years? Questions like that were ones that I heard over and over again. So let me do a few before and after questions to show you how you can elevate those questions. So, for example, you as an applicant might ask, can you tell me about the opportunities to do research here as a resident? And that's a fine question, but you could also adjust it a little bit. And you could really make it clear why you as the applicant are asking this question. So for example, Dr. Smith, I know that you're a translational researcher. I was able to complete 2 translational research projects in medical school, and that was an area of deep interest to me that I'd love to continue in residency. Can you tell me a little bit about the research opportunities that are available here at your program? So now you start to see how this applicant has a genuine interest in asking this question. They're not just checking off a box. Let me ask you another question. So, for example, let's say I'm interviewing at a family practice program. Dr. Patel, can you tell me about the types of procedures that your residents are able to learn in this program? Decent question, but here's another way to ask it. Dr. Patel, as you know, I'm from a rural part of Texas, and I would really love to go back to my community. So I know it's going to be really important for me to have a wide arsenal of procedures that I am able to perform. Can you tell me a little bit about the types of procedures that the residents in your program are able to learn? So again, you can start to see why this applicant is interested. Here's another potential question. Can you tell me about the mentoring opportunities or the mentoring programs that are offered at your program? Versus, I was at dinner last night and I was talking to one of your residents, Susan, and she was telling me how valuable the mentoring program offered by your residency program has been. And in fact, she told me that her mentor had helped her write a patient safety grant. And I thought that was fantastic. Can you tell me a little bit more about the mentoring program offered and how residents can best make use of those mentoring programs? And then finally, let me give you one other example. I know your program is really known for its health disparities curriculum. Can you tell me more about that curriculum? Versus, Dr. Garza, I was really excited to read about the health disparities curriculum that's offered by the Strong Residency Program. And one of the reasons I was so interested in that is because that's something that I've been involved with in my undergraduate days and through medical school. And I would love to really be able to continue my work in health disparities when I'm done with residency. Can you tell me a little bit more about that health disparities curriculum and how residents who are interested in this area could take full advantage of the opportunities here? So, those are some examples of before and after questions. And in the next section, I'm going to talk a little bit about how you can start to craft those kind of stronger questions to ask your residency interviewer. So I really talk about several steps involved in creating these strong interview questions. And the first step is to reflect. The second is to research the program. And the third is to really look for commonalities. So when I say reflect, I want you to sit down and actually think about your own interests, your own goals, your own mission. And this might take a while, but it can be helpful to look over the activities that you've done, the research projects you've been involved with, the organizations you've worked with, any volunteer work you've done, and you may start to really be able to identify areas that you're interested in, perhaps your ultimate goals for your career, your mission, and you can start to think about what it is that you are genuinely interested in getting out of a residency and in what you're looking for in a residency program. So the first step is reflection. The second step is research, and by that I mean researching the residency program. And I don't mean just looking at the website. When I say researching a residency program, you really need to go in depth. I talk about the AEIOU approach to researching a residency program, and this approach can help you with multiple questions as you're doing your interview preparation. So, A stands for aims. What are the aims or the mission of the program? E is excellence. What are the areas of excellence at this program? What are they known for? I is initiatives. What does the program want to be known for? So what are some of the initiatives that the program is describing or talking about? O is opportunities. What are some of the opportunities that you would find here at this program that you wouldn't find anywhere else? Whether that's a unique aspect of the clinical care that they provide, whether it's a specific multi-specialty clinic, a specific patient population, a specific location. There are opportunities here at this residency program that you're not going to find anywhere else, or that you're going to find at very few places. And then U stands for unique aspects of the curriculum. So I talked about health disparities curriculum. There might be other unique aspects to the educational opportunities here, such as a patient simulation lab or a recognized patient safety curriculum. So you really need to go deep into researching a program. And how do you find out this information? Well, definitely you start with the residency program website, but go deep. You're going to want to look at the faculty, and you might even decide to look up their publications. Going back to the website, you should definitely look up and see if they're in the news, if there are any press releases. Are they talking about specific achievements of the program or specific achievements of its faculty? And then beyond an online search, you can also start to talk to people. You can talk to residents who are currently at that program, or maybe residents who graduated from that program, or you can speak to your own faculty mentors and start to learn about the reputation of the program. What are they known for? What do they wish to be known for? What are their areas of excellence? So this is all information that might take a while, but it can be very helpful in multiple residency interview questions. And then finally, that last step is to think about areas of commonality. What are you interested in? And what are some features of the program that you really want to learn more about? And that brings me to my main point of trying to go through this process to find the right questions to ask. And that is that you really need to be asking questions that are important to you. Now, the way you ask the question and the way you frame that question can highlight your own interests, your own mission, but ultimately that's the reason you're asking the question. It's not just something that you're checking off on a box. You're asking these questions because they are important to you. So you really need to really remember that. Finally, I did want to give you a few cautions. So there are some questions that you need to be careful about. In other words, there are some questions that you need to avoid. First of all, you're with a faculty interviewer, so you don't want to ask questions that would be best asked of somebody else. So this is not the time or the place to be asking about salary or vacation time or weeks on call, anything like that. That's really questions that you need to reserve for somebody else. Second, you really want to avoid questions that might highlight a deficiency in the program. So if you're really interested in research, but this is a community-based family practice program that does not have any research opportunities, you shouldn't be asking that question. And your research ahead of time will tell you what areas to avoid asking. The third is that you want to be careful how you ask. So you don't ever want to say something like, why don't you have a more diverse patient population? Why don't you have an HIV clinic? And, the way you ask questions can come off a little accusatory. So you want to make sure that you are careful in the way that you ask questions. So, and then finally, if you are not, you might have spent a lot of time preparing the perfect question to ask, but if they don't ask you, do you have any questions for me? Don't ask any questions. You really always want to follow your interviewer's lead. And finally, how many questions should you prepare? Well, typically you'll only have time for one or two because most interviewers ask this question at the very end of the interview, and you really want to be respectful of their time. So you might only have time for maybe one, maybe two questions. Now, there are some times when an interviewer might start with this question that's pretty unusual, but it is good to have multiple questions prepared. So you don't want to just stop at one question. You don't want to just stop at two. You do want to have several prepared if your interviewer keeps going with this. But typically we found, you'll only have time for one or two questions. So I want to wish you all the best with your residency interview. We do have several blog posts on this topic about residency interview questions, and you can find those at our website, which is thesuccessfulmatch.com. So I want to wish you all the best during your residency interview. Good luck.